So, looking across the three plenary presentations in this past session, what are kind of the main takeaways that patients should be paying attention to?
Well, I think what is important and what was highlighted is that we're making progress in the adjuvant space as well as in later line of the disease. And that is based, among others, on the fact that we have new drugs. One class of drug is what we call HIF inhibitor. The first in class is belzutifan. And this agent has been added to immunotherapy in the adjuvant space. And so it was interesting to see that the addition of this treatment in the adjuvant prevent further disease recurrence. So that's great news for the patient. That is a game changer. And also that we're having more and more drugs in this class that are being developed. One side effect being anemia, and how anemia is impacting potentially the quality of life for our patient, right, both in adjuvant after surgery or when we use that at a later stage. So great news, new class of drug that is being tested and basically now will change our standard in post-surgery as well as in later line with new assets being developed for the patients.
So one of the questions that many patients have and their clinicians have after they've had surgery for a kidney tumor is what's their risk of a recurrence? And would they benefit for treatment to reduce that recurrence? So there was a paper presented at this meeting about KIM-1, which is a blood-based test that's in development. It's not quite ready for clinical use, but it's associated with a greater risk that the cancer might return. And it's also been associated now in a number of trials of more likely to respond to immune therapy. So the question then becomes, how do we take it from these interesting early results into the clinic? And now we're going to potentially do trials to do just that. And hopefully that will limit the use of these drugs to the patients who need it in the future.
So it's about patient selection, ultimately.
Yeah.
Who needs this additional treatment after surgery?
Great. So looking kind of ahead, looking at all of the research that's being presented over the course of the summit, what do you think has the greatest potential to change patient care?
What I'm excited about is
Yeah.
any new mechanism of action. Mm-hmm. And one thing that is very amazing about this meeting is that not only we see how to optimize existing treatment, but also we see the flow of new research and potential new assets that are arriving, being tested, or the rationale behind these, so the biology that takes us to develop more research. So that's, to me, is the enthusiasm around this meeting.
Right, and one of the important things is how do we fund that research? So there were lots of discussions at this meeting, given the challenges with funding at the NIH, what we can do to support this research, what we can do to support junior faculty or starting in this career path. We want to keep them moving forward. So we came up with some ideas on how we might do that.